I don't want to keep you guys too long. There is football on tonight. So welcome. Thank you for joining us for part 3 of the Medicare 101 4-part series. Tonight, we're going to be talking about Medicare Part D in detail. Couple of quick notes. I will be pausing throughout the presentation to see if anybody has any questions. If you have any questions, you're welcome to type them into the chat box at any time, and I will address them as I pause. Or when I do pause and ask to see if there's any questions, you're welcome to simply unmute yourself and ask your question at that time. So I think that's all. So let's get started. I'll try and get you in and out of here as quickly as I can. All right, so again, welcome. My name is Roma. I'm with the Area Agency on Aging through the Pikes Peak Area Council of Governments, and I am the coordinator for the SHIP program, which is the State Health Insurance Assistance Program. We're going to start with the Area Agency on Aging. The mission of the Pikes Peak Area Agency on Aging is to work with our communities and 3 counties, El Paso, Park, and Teller, to develop and coordinate systems that help people stay in their home for as long as possible. Through the Area Agency on Aging, there is the SHIP program. The SHIP program, which stands for State Health Insurance Assistance Program, is a federally funded program that's designed to provide free and unbiased information and education on all things Medicare. So anybody has any questions, concerns, needs information or education about any parts of Medicare, anything related to their Medicare, we are here to help. The SHIP program through the Pikes Peak Area Agency on Aging actually serves 9 counties in Colorado. I've listed them on the slide. Every county in every state of this country has access to a SHIP program, if nothing else through a toll-free statewide number. On the slide, I've listed our local Colorado Springs number as well as the statewide toll-free number that will route you to the SHIP office closest to where you're calling from. You may be sent a survey at the end of this presentation or sometime in the next 24 hours. This is a survey being done by Medicare directly through the Administration for Community Living, sorry. And it's to gauge how satisfied people are with these educational presentations. So if you get contacted for a survey, it'll probably be by email. It is a legitimate survey, and I would appreciate anybody who completes the survey. It does go towards the amount of funding that the SHIP program gets throughout the country. This presentation is in partnership with the Pikes Peak Library District. We've had a very successful partnership with the Library District for several years now, and we completely appreciate their participation and willingness to work with us to help provide the community with this educational program. Quick review of the first 2 weeks' topics. So again, this is part 3 of a 4-part series. In part 1 of the series, 2 weeks ago, we talked about Medicare eligibility and enrollment, and we talked about the different parts of Medicare A and B, the costs, the coverage, and that kind of stuff. In week 2, we talked about Medicare supplements, also known as Medigap, and Medicare Advantage plans. And tonight we are going to talk about specifically the newest benefit of Medicare, the newest part of Medicare, Medicare Part D. D stands for drugs. It's the prescription drug benefit that is available now through Medicare. So let's start with, what is Medicare Part D? So Medicare Part D, again, is the newest part of Medicare. It was initiated in 2006, and it provides outpatient prescription drug coverage only. So prior to 2006, Medicare did not include a drug benefit of any kind. People were totally responsible for paying all out-of-pocket costs for their medications. When Part D was initiated in 2006, it was developed to basically be a drug plan. So the plans that have developed from Part D or for Part D include a list of covered drugs, a range of different types of drugs that have to be covered, and other specifics that we're going to talk about today. Most Part D benefit plans do have a monthly premium, and you will typically have a deductible, and you will typically have copays at the pharmacy. There is programs or are programs available to provide financial assistance for people who are eligible to help with the costs for Part D. And we're going to talk a little bit about all of that. So, should you enroll in Part D? Well, as with every part of Medicare, A and B included, enrolling in Part D is optional. It is not absolutely required by anybody that anybody enroll in Medicare. However, if you want certain benefits or certain coverages, you would have to enroll and follow the guidelines and the rules. In order to be eligible to enroll in a Part D plan, you would have to be already enrolled in Medicare Part A or Medicare Part B, or both A and B. Unlike Medicare Advantage plans and Medicare supplements or Medigaps, you do not have to be enrolled in both A and B to be able to enroll in a D, just A or B or both. If you already have another type of drug coverage that would be considered creditable, meaning as good as or better than what Medicare Part D can provide you for drug coverage, you may not need to enroll in a Part D. Examples of creditable drug coverage that would allow you not to have to enroll in a Part D would be if you use the VA system for your pharmacy benefits. VA drug coverage is considered creditable. If you have drug coverage that's as good as or better than what Medicare Part D offers through a retirement benefit or an employer plan, you would not need to enroll in Part D. And we're going to talk a little bit about that as we go along. If you have the option of other current credible drug coverage, you may still want to review Part D as an option and kind of compare what you're paying for the drug coverage through your current benefit through what it might cost you through a Part D benefit. Most of the time, your current benefit is going to be better and save you more money, but not always. And it never hurts to take a look to see which way would be more cost effective for you. You may also want to consider whether or not you pay extra for the drug coverage you may currently have that would be considered credible versus what it would cost to have that same drug coverage under a Part D benefit. If you don't have other creditable drug coverage that would allow you to not have to enroll in a Part D or not need to enroll in a Part D, again, enrolling is optional. And I do get the question quite often from people who don't take any prescription medications as to why they would want to enroll in a Part D, even though they don't take any prescription medications. And there's a couple of reasons. First and foremost is because we usually buy insurance not because we need it, but in case we need it. And so, life happens. We have no idea what the future holds. And if you purchase a Part D when you first become eligible to do so, it guarantees that if something happens down the road, you have that coverage. The other reason would be if you don't have another available creditable drug benefit available to you, but you don't take any medications and you choose not to enroll in a Part D, you would be allowed to enroll in a Part D down the road any given year during the annual open enrollment period. But because you did not have other drug coverage in the meantime, you will be charged a late enrollment penalty. And we're going to talk about what that costs and what that looks like a little bit more as we go. So the bottom line is if you don't enroll now and you don't have other creditable drug coverage, you can enroll in the future, but you will pay a little bit more to do so. There are some enrollment periods that you do need to be aware of for your ability to get into a Medicare Part D. As we talked about in the first 2 weeks, the initial enrollment period, which for most people surrounds their 65th birthday or the month of their 65th birthday, which is that 7-month window, the 3 months prior to the month of the 65th birthday, the month of the 65th birthday, and up to 3 months past the month of the 65th birthday. That is your initial enrollment period, that 7-month window, where you can enroll in any parts of Medicare, including Part D, without penalty. If you enroll during the first 3 months or the 3 months prior to the 65th birthday, any enrollment you do would go into effect the month of your 65th birthday or the month you become eligible for Medicare. If you enroll during the month of your 65th birthday or any month thereafter, it would start typically the following month. Regardless of whether or not you enroll in a Part D benefit during your initial enrollment period, you would still have the ability to enroll in a Part D any year down the road during the annual election period, also known as Medicare Open Enrollment, which has just started last week, and it runs October 15th through December 7th every year. Any enrollment you do during the general or the annual election period for Part D wouldn't go into effect until January. Now, having said that, if you are turning 65 between October and December, you're not in the annual election period. You're still in your initial enrollment period. And so the annual election period would not apply to you until next year. So if you're just becoming eligible for Medicare during this time of year, the annual election period does not apply to you because you're still in your initial enrollment period. And then, as with most things Medicare, there's always opportunities for special enrollment periods, which fall under special circumstances, such as losing other creditable drug coverage, quitting employment or losing employment or retiring from active employment that had creditable drug coverage, those kinds of things. Again, if you choose not to enroll in a Part D when you first become eligible, and you don't have other drug coverage that would be considered as good or better than what Part D could offer you, you would be allowed to enroll any given year down the road during the annual election period, open enrollment. But for every month that you were without drug coverage of any kind, you're going to have a 1% penalty applied to whatever premium you choose to pay in the year that you enroll down the road. That 1% per month penalty for every month that you didn't have creditable drug coverage, Part D or otherwise, is going to be based on whatever the national average monthly benchmark premium is for that year that you enroll. For 2021, the national average benchmark premium, which means the national average of all Part D plans across the country, for 2021 is $33.06. So, for example, if you became eligible for Medicare 2 years ago, and you didn't take any medications, you didn't have other drug coverage available to you, and so you chose not to enroll in a Part D, but you're going to enroll during this open enrollment period, you would be charged potentially 1% for every month you didn't enroll. So that could potentially be 24 months or a 24% penalty. That 24% penalty would be multiplied by $33.06. And whatever that came out to would be tacked on top of whatever premium or whatever plan you chose to enroll in at this time every month forever. So again, as with all Part B or Medicare penalties, once you incur them, they last forever. They never go away, and they're applied every month. The Part D penalty is usually much smaller because it's based on a much smaller amount. But again, because it lasts forever, it can add up over time. If you qualify for financial assistance with Part D coverage based on having limited or low income and resources, even if you enroll late, they don't apply the penalty because you qualify for financial assistance. And we'll talk about that a little bit more as well. But again, as with all all Medicare penalties, once they're applied, they never go away. They last forever. Another thing to be aware of for Part D, as well as Part B as in boy, is the income-related monthly adjustment, or IRMA, as the government likes their acronyms. What this is basically a means testing applied to Part D and Part B premiums for people who have higher incomes. So if you have a significant income, when you become eligible for Medicare, you may end up having to pay a slightly higher Part B or Part D premium based on the fact that you had that higher income. Again, this is something that's determined by Social Security. We talked a little bit about it on week 1. And Social Security is going to base whether or not they try to apply a higher premium to your benefits on the most recent complete income tax filing that they can access, which typically is going to be old information, 2-year-old information based on whenever they look at it. And for many people, 2 years ago, they may have had a much higher income than they have today. They may have retired in the meantime, whatever. If you had a higher income based on the amounts shown in the slide, and the threshold starts at $88,000 for an individual, $176,000 for a couple that files jointly. If your income was at that level or higher, then you could potentially pay a higher Part B and Part D premium. But because Social Security bases their determination on who has to pay more on old information, if you get that notice from Social Security that you may have to pay a higher premium and your income is no longer at that level, there is a process that you can appeal that decision so that you're not having to pay that higher premiums if your income is no longer at that level. Again, it's going to be based on income. There are 6 tiers of income that they look at, and the higher tier that you fall in, the higher premium you may have to pay, the higher amount that will be tacked on to the premium of what you decide to enroll in. But again, that information is appealable. That decision is appealable through Social Security if your incomes are no longer at that level at that time. Any questions about any of that so far? Again, if you have a question, you can simply unmute, or you can always type your question into the chat box. All right, I'm not seeing any questions typed. I'm not hearing any questions spoken, so we will move on. So now we're going to talk about the actual coverage for Part D and how it works. So the Medicare Part D benefit, again, established in 2006 and was honestly put together fairly quickly by Medicare. Once the federal government decided that it was going to have a drug benefit, they had to pretty much come up with how that was all going to work in a pretty short amount of time. All things considered, it was very impressively done and very well structured. So for Medicare Part D, there is a basic outline of coverage, which means Medicare has established a minimal level of coverage that any Part D provider can offer, or better. But at the minimal level, that is the least amount of coverage that you can be offered by any company that is providing a Part D benefit. That minimal or basic level of coverage dictates that there will be an annual deductible. For 2021, that annual deductible is $445. That deductible has increased for 2022, and it's going to be $480 next year. And what that means is if your Part D coverage has a deductible, what that means is that when you enroll in a plan and you go to the pharmacy for the first time, you're going to have to pay full retail cost for your medications until you spend up to the deductible amount of $445. Once you've met that deductible or spent that amount of money, the next time you go to the pharmacy, you should be able to pick up those medications at a much lower cost. That cost is representative of approximately 25% of that retail cost. So you would pay 25% of the retail cost as your copay, and your plan would pay the other 20 or 75% of that cost as your coverage. You will continue to pay that 25%, and the plan will pay the other 75%. And as you're doing that month to month, what Medicare and the plan are doing is they're taking the $445 you spent out of pocket in deductible, and they're taking the total cost of the total retail cost of the medications you have been purchasing after deductible, even though you're only paying 25%, they're taking the full retail cost. And they're adding up that cost every month for every drug that you purchase in a column back here where you can't necessarily see what they're adding up every day. And if the total dollar amount in this column, and again, this is going to be representative of the retail cost of medications, if the total retail cost of your medications in this column adds up to the coverage limit this year, which is $4,130, if you reach that limit in total costs, you will hit what they call the coverage gap or the donut hole. Now, the donut hole, when it was created, dictated that if you reach this coverage limit and entered the donut hole, you would go back to paying 100% full retail cost of medications once you hit that point of your coverage. And that's how it started in 2006. If you hit the donut hole, you had to go back to paying full retail cost for your drugs until you reach the other side of the donut hole. But what has happened over time is that the government decided that that was too burdensome for beneficiaries, and they started to close the donut hole. And so gradually over the years, the amount that you pay if you hit that coverage gap or that donut hole has reduced from 100% of full retail down to 25% of full retail. And in 2020, when it hit the 25% amount, which is the most you'd ever pay in cost during the coverage gap or the donut hole, they consider the donut hole closed. So the donut hole does not mean you don't have to pay anything. What it means is you go back to paying 25% of the retail costs. Now you may be sitting there thinking, well, isn't that what I was paying in copays before I got there? And the answer is yes. Again, keep in mind that this outline that we're reviewing is the bare bones minimum level of coverage that any drug plan can offer you. And quite honestly, most plans do better than this. For example, if you have a drug plan that, say, had a deductible, but once you met your deductible, if you had tier 1 generic drugs, you may not have had any copay at the pharmacy, zero copay. If you had zero copay for some of your medications, if you hit that coverage limit and got to the donut hole, those zero copays would suddenly go to 25% of retail. So you paid full retail during the deductible, you paid zero copay after deductible. If you hit the donut hole, you're going to go back to paying 25% of retail for that medication. That's where you may see a difference in what you pay if you hit that coverage gap. Sometimes that is going to mean you're going to pay less than you paid in copay. Sometimes that means you're going to pay a little bit more than what you were paying in copay after deductible. While you're in the donut hole or coverage gap, Medicare and the plan are still adding up some of the amount that you pay towards your medications month to month. So they're continuing to add to that $4,130 amount that you had hit to get there. But now they're only applying the 25% that you pay. So they applied the whole retail amount to get you there. But once you got there, now they're only continuing to add to this column the 25% that you're paying at the pharmacy. If somehow before the end of the calendar year, you still manage to add up enough drug cost in that column to reach the other side of the donut hole, meaning your total drug costs equaled over $10,000, then you would have reached what they call catastrophic coverage. If you hit catastrophic coverage, what that means is your cost at the pharmacy for medications goes down to 5% of retail, or a copay of $3.70 or less for generics and $9.20 or less brand name copay per month. Then the plan pays 15%, and then the government pays the other 80% of the cost of your drugs. And then come January 1st, that cycle starts all over. So this is what would have to happen, or this all happens within a 12-month calendar year. Again, this is the minimum amount of coverage that any insurance company can offer as a Part D benefit. And honestly, most plans do better, much better than this. So this is a worst case scenario. Medicare also has requirements for what kind of drugs have to be covered as a Part D benefit. And Medicare does require that all drug plans that are offered anywhere in the country have to offer at least 2 medications in every medical class of medication. So for example, if you take a high cholesterol medication, and there are 20 different high cholesterol medications out on the market, each plan will only have to cover 2 of those 20 on their formulary to be in compliance with Medicare. As long as they're in compliance with Medicare, then they can continue to offer Part D coverage. What that means for you is it becomes much more important to make sure that whatever plan you choose to enroll in covers your specific medications. Because every drug plan being offered from any company that has been approved to do so will have a different list of drugs that they cover. And because they can pick and choose what 2 out of those 20 high cholesterol medications they want to cover, every plan may cover a different medication. So you need to make sure that your specific medications are covered by any plan that you think about enrolling in. There are 6 classes of medications that Medicare requires these plans to cover any and everything that's available on the market. And those are going to be any antidepressants, antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and antineoplastics. Anything on the market that's available in those 6 categories of medication have to be covered by all Part D plans. In order to be allowed to be covered or offered through a Part D plan, medication has to require a doctor's prescription. And that doctor's prescription is usually going to be the script that they write out while you're talking to them in the office, and they hand you. You take that to the pharmacy to pick up your medication. Part D coverage is only for outpatient medication that you would go pick up at the pharmacy. Any medication covered or prescribed has to be approved for use by the FDA, and it has to be approved for use for its medically intended purpose. What that means is that if a doctor is prescribing Viagra for blood pressure issues, that would not be an approved reason for a plan to cover Viagra, because that is not the medically intended purpose that Viagra was created for. So that's just as an example. So only drugs that are being prescribed for their intended use or creation would be approved through Part D. All Part D plans do have to include drugs and biologicals, including insulin, and the supplies for injecting insulin, syringes, the swabs, the gauze. And all plans must include brand name and generic drugs on their formulary. However, I can guarantee you that if you take a brand name medication and halfway through the year, suddenly that medication's patent expires and it becomes available as a generic, that plan would be allowed to stop paying for that brand name medication and only want to pay for the generic version of that medication once that happens. And they would be allowed to do that mid-year when that drug went generic. They are also required to inform you if they're going to do that with a minimum of 30 days notice, but they would be allowed to do that. And then of course, there are things that Part D does not pay for. And that is going to be any medications that you received under Part A or Part B of Medicare. So any medications you were given while you were inpatient in a hospital would be paid under Part A and not be a Part D. Any medications you receive in a medical setting. So if you are receiving chemo treatments or dialysis, or you receive an infusion or an injection that the doctor has to give you when you go for a doctor's appointment, those kind of drugs would be covered under Medicare Part B, the outpatient benefit, because they have to be given to you in a medical setting. Again, the only drugs covered by Part D are the drugs that you would take the script to the pharmacy and get them filled yourself. Medicare Part D also does not cover anything considered over the counter, meaning it doesn't require a prescription. And even if it requires a prescription, if a drug is specifically to treat anorexia, or if it's for fertility purposes or cosmetic purposes only, it would not be covered by Part D. Even if it requires a prescription, if it's specifically used for cough and cold symptoms, and Robitussin is a perfect example of that, it would not be covered under Part D. And most vitamins and mineral supplements are not going to be covered under Part D, primarily because they don't usually require a prescription. Now, there are some exceptions to that rule for vitamins and minerals that do require a prescription to treat specific diseases or conditions. Okay, so I will stop. I do have a couple of questions in the chat. Again, if you do have a question, you're welcome to simply unmute and ask your question. But real quick, let me address these questions in the chat. First one, regarding IRMA. Does the IRMA apply if I was laid off a full-time job and unemployed through that month and currently working part-time? So again, the IRMA is going to be calculated by Social Security. And the way they're going to determine who IRMA applies to is by looking at the most recent complete income tax filing that they can access. So because we have not filed taxes for 2021 yet, and hopefully most people have completed their taxes for 2020, the most recent information they can base that decision on is what you filed for taxes in 2020. So regardless of what your income was for 2021, they're going to look at what you made for 2020 and base their determination on that. Again, if you get that notice that you may have to pay a higher premium, but your income currently isn't at that level, you can appeal that decision. And that appeal process is outlined on whatever notice Social Security would send you, indicating that you may have to pay that higher premium. So hopefully that answers your question. Social Security will review that information annually because they know incomes can change. So even if you get a notice for this year based on 2020 income, if your income changed in 2021 and they review it again, you may not have to pay that higher amount in 2022 because your 2021 income was lower. But just keep in mind that they're basing that determination on whether or not you should have to pay more on old tax information, old income information. So hopefully that answers that question. Next question, why does PARA say not to apply for Part D or their Advantage plans? Okay, so PARA is a retirement benefit for public employees, and the Medicare offerings that they offer for their retirees with Medicare are kind of like Advantage plans. They're customized Advantage plans, and they're customized because they're provided through a retirement benefit. What that means is they're not going to be like regular Advantage plans that you see commercials on TV for. These are plans that have been customized by PARA, specifically for PARA retirees. And those Advantage plan offerings, or any insurance offerings through PARA, include what's considered creditable drug coverage, meaning it's as good, and honestly, it's better than what Medicare Part D offers. So you would not need to apply for a Part D. If you actually did apply for a Part D anyways, it could theoretically kick you out of the PARA care coverage, and you wouldn't be able to get back in until their next annual enrollment period. So hopefully that answers that question. If you have the ability or the availability of retirement coverage through a past employer, such as PARA, such as if you're a federal civil service retiree and you get federal employee benefits, if you're retired military, if you use the VA system for your pharmacy benefits, all of those kinds of offerings are going to have coverage for drug benefits that are better than what Part D offers. And there would be absolutely no advantage for you to enroll in a Part D plan And again, in many cases, if it's a retirement health benefit that's being offered to you, that includes that drug coverage, if you enroll in a Part D anyways, it could kick you out of that coverage through the employer. So keep that in mind and just be mindful of that. And if you have any other questions specific to that, it's always best to talk to the retirement planner or the retirement benefit department to make sure that you're not going to do something that would jeopardize your current benefits. Any other questions about any of that? All right. So that's the basics of how a Part D plan works. Again, what we looked at initially, that initial outline, is going to be the minimal amount of coverage that any Part D plan can offer you. For Part D benefits, what Medicare has done is they have created the benefit. They have created all the rules. They've determined how it's going to work, what requirements there are, what drugs must be covered, what drugs can't be covered, how they're going to be paid for, what can be charged to the pharmacy. All those kinds of things are determined by Medicare. And then what Medicare did is, after they made all those decisions, they chose to allow private insurance companies to contract directly with them to provide that benefit on Medicare's behalf. So when you are purchasing a Part D benefit or a Part D plan, you are actually purchasing that benefit directly from a private insurance company. So if you get a Humana Part D drug plan, you're buying that Part D benefit through Humana or through AARP or through any number of the companies that have agreed to contract with Medicare to make this available to you. So that can make it a little more confusing, and it can make it harder to understand why you're getting all of that junk mail in the mail. But what you need to remember is you buy a Part D benefit from a private insurer that has to follow all the Medicare rules and guidelines. You pay that insurer a premium directly, but it is your Medicare Part D benefit. So I just want to make that clear. Very similar to an Advantage plan, where Medicare contracts directly with the private insurers that offer the Advantage plans to act as Medicare on Medicare's behalf. Pretty much very similar for Part D as well. Again, I mentioned there may be some financial assistance available for people who are on limited or low incomes, specifically for Part D. The financial assistance is actually applied for through Social Security directly, and it's an incredibly quick and easy application to complete. If you do it online, it takes less than 10 minutes to complete, and you get a response usually in about 3 weeks. If you are already receiving some sort of assistance through SSI, Supplemental Security Income, or if you are on Medicaid for any reason already when you become eligible for Medicare, or if you are eligible for and have applied and been approved for the Medicare Savings Program. If you have any of those benefits, you automatically get the financial assistance for Part D based on being eligible for those other programs. The financial assistance for Part D has several different levels of income and asset eligibility, and different levels mean different levels of assistance that you might qualify for. But it is financial assistance, so it is going to be based on someone's total gross income and total assets. Again, you can apply directly for that benefit through Social Security on their website, ssa.gov. You can call Social Security directly at their national number, the 800-772-1213, or you're always welcome to call your local SHIP office. That's us, and we are happy to help with those applications or even help determine if you're eligible. But we can always help you apply for those applications over the phone. Income and asset limits for help with Part D are a little bit higher than they are for the Medicare Savings Program that we talked about a couple weeks ago. Maximum monthly income someone can have to qualify for assistance for a single individual is $1,630, and that's all pre-deduction income or gross income. For a couple, it'd be $2,198 in 2021. Maximum total liquidatable assets that they would look at for a single person is $14,760. For a couple, just under $30,000. Keep in mind that assets that they cannot or do not look at are going to be the home you live in and the property it sits on, your primary vehicle, and personal possessions. So if you have a $50,000 diamond ring on your finger, that is not going to be counted as an asset against you. What they're going to look at is any income or any monies you have in any sort of financial account, whether it's checking, savings, investments, 401ks, IRAs, or annuities. All of that is what they're going to look at for assets and total all of that up to see if you fall above or below those asset limits. If anybody is interested in getting more information or talking about this program in more detail, again, you're always welcome to give us a call or shoot us an email, and we're happy to discuss this further with you. Or like I said, we can help you apply for that benefit directly. If for some reason you don't qualify for the help, the financial assistance for Part D, but you're still struggling to cover the cost of your medications, even with a Part D plan, the other option we can look at are patient assistance programs directly from the drug makers. Patient assistance programs typically require that you don't qualify for the financial assistance through Social Security. And they typically have much higher income and asset limits for people to qualify. And some companies may even allow you to apply and get the assistance directly from the manufacturer if you have a Part D, but you fall into that donut hole or that coverage gap. If you qualify, you apply and you're approved for patient assistance for any of your specific medications through the drug manufacturers. That typically means you will have very little or no copay for that medication for the rest of the calendar year. Primarily, patient assistance programs are going to be applied only to prescriptions that are brand name and much more expensive. Usually, if something has gone generic on the market, it will no longer qualify for patient assistance through the manufacturers. We have also listed some of the websites that you can access to find out if your drug falls under a patient assistance program through the maker. Not all drugs will, but again, some of the more common and some of the more expensive medications will have some sort of patient assistance available to look at. You can get that information directly from the Medicare website Plan Finder, or again, we've listed some additional websites that we have used that can give you some additional information about that eligibility. So how to find the best Part D plan for you. Again, I mentioned that Medicare contracts with private companies to offer this benefit to the public. So the number of companies that are available to choose from for Part D can vary from year to year. I can tell you for 2021, we had a total of 27 different drug plans to choose from. Each plan had a slightly different formulary. Each plan had a different premium, had different copays, etc. For 2022, unfortunately, we are down to 20 different plans to choose from. So there are fewer options available. But even out of those 20 plans, what I can tell you is that there's primarily a handful of companies, and each company offers 2 or 3 different options for Part D. So there's not a lot of companies to choose from, but there are a total of 20 plans to pick from. When you're looking at these plans, the things that you need to take into consideration are going to be the plan's premiums. The plan's coverage is going to be most important. Is it going to cover the medications you take? And your copays, your deductibles, your coinsurance, whatever you have to pay out of pocket at the pharmacy. The best way to get that information is to go to the Medicare website. On the Medicare.gov website, Medicare has actually created a search engine, basically, called the Plan Finder. And what this Plan Finder can do for you is it allows you to enter in all of your specific medications down to quantities, dosages, the whole 9 yards. It allows you to enter up to 5 preferred pharmacy preferences. So you can pick up to 5 pharmacies that you want to compare costs at. And the end result of entering that information is that it will list all 20 drug plans or 27 drug plans available, however many there are in that given year, in order from the plan that would save you the most money on your specific medications at the top of the list to the plan that would cost you the most money out of pocket at the bottom of the list. So basically, this Plan Finder function does all the work for you. It takes all the medications, compares it to all the pharmacies and all the Part D plans out there, adds up all the costs, and the end result is it will show you what plans would save you the most money. The other way you can look at it is by contacting each Part D plan provider directly and asking them to look up all your medications, make sure they're covered, and tell you what those copays and premiums would be, which could be honestly kind of time consuming. You can call an agent or a broker and ask them to do that for you. But the Plan Finder through the Medicare.gov website is going to be your most effective, your most efficient way to find that information. Again, as a SHIP program, we are happy to help you with that. As a matter of fact, that's all we're going to be doing for the next 7 weeks, is helping people by going through the Plan Finder with their medications to see if there is not a more cost-effective option available for next year if they're already on Part D on Medicare, or finding a plan that's going to be most cost-effective for them if they're just becoming eligible for Medicare. We have many years of practice doing it, and we're always happy to help with that. I did send an email out before the presentation started. I think I sent it around 3 or 3:30 to everybody who registered. There were a couple late registrations that I'll have to catch up on afterwards. But if you received that email also included some handouts, as did any of our presentations for the previous 2 weeks. I know in week 1, I included the handout about how to create a Medicare account on the Medicare.gov website. Medicare does not require that you create an account on their website, but there can be significant advantages to doing so. If you're able to create an account on the Medicare website, it will save all of your information, including the list of medications that you may enter into it, so that you don't have to type that list in every year when it's time for open enrollment and to review your coverage. It also saves a history of all the plans that you've been enrolled in. It gives you the ability to print a temporary replacement Medicare card if you lose yours. It has an electronic health records function that you can allow your doctor to access if you're into that. It can give you the ability to look at Medicare claims in real time as they're being submitted by your providers. And that's for original Medicare claims only. It doesn't apply if you have Medicare Advantage plan. But there are a lot of advantages and a lot of options and things that having an account can be useful for. But again, it's not required. You don't have to have an account to use the Plan Finder and search for your best drug plan option. But again, there are advantages, and it literally takes a few minutes to set up the account. All you really have to do is confirm your Medicare information and then create a login and password. Very, very simple and easy, and could be very advantageous. Again, the Medicare Plan Finder from the Medicare webpage is going to be the most effective way to find the best plan for you. I'm going to give you some screenshots real quick of the Medicare Plan Finder just to give you a place to start. I will probably start doing some Plan Finder presentations and walkthroughs through the Plan Finder early next year. But I wasn't able to get that done but once before open enrollment started. But this will get you started. So what you're seeing here is the homepage for Medicare.gov. The picture may change slightly or change from day to day, but the basic outline or layout is going to be the same. So this is the home page, and the first thing that you're presented with is the option to find health and drug plans or log into an account that you have already created or create an account on Medicare. And then under that, you have other options to pick from to find additional Medicare information. If you're going to try the plan finder, obviously you're going to want to find health and drug plans. So I would click on that. The next page you're presented with is either to log in or create an account. But if you look under that in smaller print, not as obvious, there is an underlying link that says you can continue without logging in or creating an account. And that's if that's something that you don't want to do, that's where you would go, is just log in without creating an account. And this is going to take you directly to the search and compare options. Again, once you get past that page, it's going to ask you what your zip code is. It's going to ask you if you want to look at drug plans, if you want to look at Advantage plans, if you want to look at both. And then it's going to ask you if you know if you qualify or have applied and been approved for extra help. Once you get past that, then you start typing in your medications. Once you've completed typing in your medications, you tell it what pharmacies you want to choose from. Once you enter the pharmacies, you get to that end result. Very short and sweet and simple to do. But again, we're happy to help anybody at any time with that process, or even just walk you through that process. The Division of Insurance up in Denver, which is the overarching director of the SHIP program in Colorado. That's where it's housed. We are very lucky in Colorado that they take the time every year to put together an independent like newspaper that provides information specifically about the drug plans available in Colorado every year. What I've got here and what I've emailed you earlier today was the 2021 newspaper for those who are becoming eligible in the next couple of months. And they are currently working on the 2022 version. Hopefully we'll have that available in electronic format in the next week or so. And if anybody's interested in that newspaper being emailed to them electronically, please feel free to send me an email. I'll provide you that contact information at the end, and I'd be happy to forward that to you. Other good resources for Medicare information, obviously the Medicare Publications, primarily the Medicare New Handbook. If you're just becoming eligible for Medicare, you are not going to be automatically sent a Medicare New Handbook this year. If you wanted to access that, you could do it one of two ways. You could go to the Medicare.gov website, and on the homepage, there should be a button you can click on that takes you directly to a PDF version of the Medicare New Handbook for 2022. Or you can call 1-800-MEDICARE and request that they mail a paper copy to you specific for Colorado. Or you can go to, again, the Medicare website, 24 hours a day, 7 days a week, 365 days a year for more information and resources. Keep in mind and remember that Medicare does not have brick and mortar locations. You can only reach Medicare either through their website or through their toll-free phone number. And then, of course, if you wanted more personalized information, you would call us, your local SHIP office. And again, we're always happy to help you with any questions, concerns, or information regarding anything Medicare. Our office is also the local Senior Medicare Patrol. The Senior Medicare Patrol is also a program through the ACL and Medicare that is designed to help people understand and be aware of potential fraud and errors and abuse of Medicare and Medicaid benefits. So we are here to educate and empower people to protect, detect, and report any potential fraud or abuse of their Medicare benefits. If you are interested in more information, if you suspect something is not above board when it comes to your coverages or benefits or what the providers are billing to Medicare, you're always welcome to call the Colorado hotline. Number is listed there. You can always go on the internet to the S&P resource website to get more information, or you're always welcome again to call your local SHIP office, and we are happy to talk to you about anything that is suspicious. and we're always looking for volunteers. The S&P program is one of the more interesting programs to volunteer for, especially if you like investigation stuff. Here's my contact information and the contact information for this local SHIP program. Again, we serve a total of 9 counties in Colorado, and open enrollment is our busiest time of year. But you are always welcome to call us at our local Colorado Springs number, or you can call us by our toll-free 800 statewide number, and it will route you to the SHIP office closest to where you're calling from based on your county. Any questions or concerns after this presentation, you are welcome to shoot me an email at seniorinsure@ppacg.org. For more information about the SHIP program in general, you can visit the shiptacenter.org. We have 5 full-time counselors, including myself and a part-time volunteer. We're all fully trained and certified by Medicare and the Division of Insurance for the state of Colorado, and we are always happy to help you. We are currently not seeing people in person at this time, but we are happy to meet with you by phone or by Zoom. And I think that is it for tonight. Any last minute questions? Oh, looks like I got a couple of questions in the chat box that I will address. But again, if you do have a question, you're welcome to simply unmute. First question in the chat is, planning on retiring at the end of December, how soon do I need to select Medicare plans to ensure coverage for January 1st? So again, if you're going to retire at the end of December, you have your initial enrollment period for Medicare. If you're past your initial enrollment period, you just simply worked past age 65. But you know when you're going to retire, you can start that planning process now and start talking to insurance companies now about enrolling to be effective for January 1st. So anytime between now and January 1st, you can start that process and start those enrollments to make sure everything is in place for January 1st. You don't have to wait until January 1st to start that process. You can do that now. And the next comment, to be clear, you can change Part D plans each year during open enrollment. The answer is yes. The whole point of Medicare open enrollment every year is because needs change. Your medications may change. The plans are allowed to make changes every year during open enrollment. So, you know, again, we had 27 plans available to choose from this year. We only have 20 to choose from next year. So that is a major change that some people will be losing their plan. They're going to have to pick a new one. But your medications may change, and the plan that you pick today may not cover your medications tomorrow. The plans make their changes, so they may change their premiums, they may change the drugs that they cover on their formulary, they may change the copays that they charge. All of those things happen and are effective for the next year during open enrollment. And you can change your Part D plan without restriction, without question, every year during open enrollment, no matter what. So it is to your advantage to take advantage of open enrollment, to make sure every year that you have the most cost-effective option available for the next year. Because keeping the same plan from year to year is typically not going to be your best option because of those changes. So don't just enroll in a plan and let it ride, because that might be very costly. Take advantage of open enrollment and review all the options available to make sure you have the best plan for your needs every year. And again, we're happy to help with that at our office. That's what we do. And we've got a lot of experience and years of practice doing that. Any other questions? All right. Well, if there are no other questions, then I will let you all go. I know football's on. Some people may be interested in doing that. You're always welcome to email me or give us a call if you do have other questions that you think of tomorrow or the next day or at any time down the road. This is what we're here for. This is what we do, and we're happy to do it. So please don't hesitate to contact us if there's anything we can help you with or help you walk you through. We're happy to do it. Hopefully I will see you all next month or next week for part 4 of our 4-part series, where I talk about the other types of coverage that might be available to you to go with Medicare, including employer coverage, retiree plans, Medicaid, COBRA, and so forth. Otherwise, thanks for attending tonight. I appreciate it, and have a good evening, and I will hopefully see you guys next week. Have a good night.